Today, I'm Desiree Lopez. Thank you for joining us. To kick off the year, many people say they are taking part in Dry January. It's a movement to cut back on drinking alcohol all month long. But if some of you find you're looking for a more permanent change, there's a place here in the Valley that can help you embrace a healthier lifestyle. Here now to let us know about treatment options is Dr. Carrie Randazzo, Clinical Director of First Steps Recovery, along with Clinical Manager Mike Eifmeyer. Welcome. How are you guys?
Thank you for having us. We're good.
Good. First of all, we need to start. Okay, what is First Steps?
First Steps Recovery is a complete continuum of care. So we are an inpatient as well as outpatient treatment provider for substance abuse, sometimes co-occurring disorders, not necessarily for mental health primary, but we do like to have family involved. We do like to help clients with their substance abuse issues, whether it be opiates, prescription medications, alcohol, those types of substances.
And Doctor, of course, as a professional, what is a problem or an issue that you see most common?
An issue, alcoholism and opioid.
That's the one that you see here more in the Valley. Is that what you will say that is?
Yeah, I think collectively, outside of what the substance might be, I think what we see the most is dependency issues, and sometimes family kind of being involved in that dependency issue, more enabling behavior and less kind of supportive or encouraging behavior.
And of course, what would you say, okay, how important is it for family to be involved during this process?
Very important, because they've been in the process of the whole thing. It affects their relationships, their finances.
And of course, for those that are struggling, like what would you recommend will be the first step to take?
I think the first step for anybody to take is to get as much education and information as possible. I think kind of obviously calling us or checking out our website or really talking to their family member and trying to get a kind of an open conversation going where the family member can feel safe and feel comfortable and really start to talk about some of their substance abuse issues, some of their behavioral problems, some problems they may be having with their employer, with their families, with their intimate or personal relationships.
And of course, what would you say that when it comes to family members, what is something that they struggle with when they try to help their loved ones?
With the client's active disease, it's hard to get them to want help when they're sick.
And Dr., what would you recommend for them to do whenever they see that? Like what are the steps they should take whenever they want to help a family member?
I think to call someone that offers help, to help us help them.
And of course, because you know, I've seen that a lot of people that suffer from addiction, they just don't want to get that help.
I know.
Right? That's something that you guys agree with as
yeah,
well?
absolutely.
Yeah, okay, so what should they do if, like, you know, you have a family member, a loved one that it just doesn't want to get that help, but you want to help them? What would you guys recommend?
I think, I mean, we see a lot of people eventually change or become motivated to come into treatment once there's consequences, right? And so if a family is somewhat enabling, if a family is covering legal issues, if they're covering financial issues, if they're maintaining bills or financial support, if they start to pull back some of that support, then it kind of puts that person in a position to be a little bit more open-minded to asking for help, and then hopefully, you know, calling us or looking online or looking for, you know, help.
That's interesting that you mentioned the consequences, because it is true. When people think of consequences, they're like, okay, you know what, I need to get that help, right? That is so important to remember. And of course, you know, what kind of treatments do you guys offer?
We have inpatient residential, we have detox, we have PHP, that's partial hospitalization, where they stay at the facility and then go home at night. We have outpatient, we provide group therapy, individual therapy, case management services.
And we do job placement, we do family interaction, family groups and family therapy. We kind of assist them with their employers and do FMLA or short-term disability benefits, whether it's through SDI or through state disability or for their own private company. And so we try to take care of what would be called barriers to treatment, right? And so the things that are holding them back from coming in initially or the things that are pulling them out early. And so that's really kind of what happens with a case manager is they kind of look at what's going on with this person's life and what's being affected in regards to their family or legal, health, things like that. And they really start to take care of that. And we have therapists on site that really get down to the causes and conditions, that really get down to those underlying issues that are kind of pushing that person towards substance abuse or pushing them towards impulsive behaviors. Sometimes it's gambling, sometimes it's self-harm or self-mutilation, sometimes it's substance abuse.
You know, it's important that people remember that, you know, whenever people are addicted to something, it's not just drugs, it's not just that, it's also gambling, like you said. There's people that suffer from that as well.
Absolutely.
And usually I know that cases, you know, they vary, but how long does a treatment usually take?
I would say it's individualized, and so I mean there's a really big difference between someone that's 19 or 20 years old that's been abusing substances for 1 or 2 years versus someone that's 45 or 50 years old that's been, let's say, drinking or abusing substances for 25 years. And so it's really a long process, and it's a really individualized process. And so how it would kind of start is that person would come in and kind of be assessed by our NP or by a physician or doctor, and we would try to understand a little bit about them and what substances they've used and how long they've used those substances and what medications are going to help them to get detoxed and stabilized. And really that's just the beginning. You know, after that is when you kind of really get down again to those causes and conditions, and we're taking care of what's happening on the outside, and we're also kind of taking care of what's happening on the inside and what's driving them to want to abuse those substances.
And of course, I know that you guys mentioned it, but I think it's important for people that are watching and they feel like, okay, they suspect that a family member might have an addiction. Let's remind them, what do they have to do, those steps again?
Again, I think the most important thing is to talk to that family member first. I think really understanding what's going on with that family member and then being there to support them but not to enable them. You can always go onto our website, firststepsrecovery.com, and there's tons of information there, tons of helpful hints to have conversations with your family members, as well as our admissions line. You can always give us a call. Family members are always welcome to give us a call and ask those questions, and our admissions team would love to take care of that for them, as well as to see if that person's going to be a fit for our program.
That is great. And of course, for people that are wondering, the number is on the screen. If you guys will want to give them a call, if they want more information, they're free to just give that number a call as well, right? Perfect. Thank you, guys. Thank you so much for that information.
Absolutely.
I really appreciate it that you guys were here today.
Thank you for having us.
Thank you.